We are live.
Good evening, everyone, and welcome to the Jessamine County Town Hall. The purpose of this meeting is to respond to some of the questions that have been asked throughout the community of Jessamine County Schools, and the Health Department. So with me today, I have the Director of the Health Department, Randy Gooch, and Dr. Davis, who also supports the work at the Health Department. So I appreciate these gentlemen being with us today. I'd also like to take just a moment before we get started to thank everyone for continuing to communicate with me, sharing your thoughts, concerns, and recommendations. I think it's also very important that you are participating this evening and took the time to share questions with us. There were several questions shared, so understand that we're not going to be able to get to all of those. So we have this town hall allocated for an hour of time, so we won't be able to get to all of the questions, but we will look for opportunities for some follow-up communications with you. Also know if it is a question of more of a medical nature or one that's more specific to the health department, I'm going to hand those questions over to the gentlemen that are with us this evening. I do want to also, before I jump into the first question, just communicate to you what I have communicated throughout this entire pandemic. Please know that safety is our top priority here in Jessamine County. I'm appreciative that the health department has helped guide us through this work, and do know that no matter what model of instruction that we're going to be providing our students, we're going to make sure that it is at the highest quality possible. October 26th is when we are making the transition to the new model of instruction that we're going to be providing our students. Just a real quick reminder, elementary students will continue to receive in-person instruction for those who have selected that option 5 days a week, and then our middle and high schoolers will be on a similar plan, in that half of the students will be attending school on Monday and Wednesday, and then the other half of the students will be attending in-person instruction on the Tuesday and Thursday. The first question is really a two-part, which is why we made the decision to transition to the model that I just described, and the other part of that is why does the elementary model look different than the middle school and high school? To answer the question why, it truly is tied to not the number of positive cases that we're dealing with in the school system. It has a direct connection to the number of students that we've been required to quarantine as a result of them having been in contact with somebody that is tested positive. To just give you a little bit of information to help you understand what we're talking about when I positive rate, number of students that have tested positive, and the number of students who have been quarantined. I think you'll find this helpful. During the first week of in-person instruction, we had 8 students that tested positive. 2 of those were siblings, and 1 of those was in our virtual learning academy. Over the break, we had 1 additional Jessamine County school student. And then last week we had 3 that tested positive. This week so far we have a total of 5 students. So those numbers combined, it's 17 students since we have returned to in-person instruction, and 2 of those students are in the virtual learning academy. The numbers get much larger when we start talking about the individuals that have had to quarantine. Again, since we started our in-person instruction, we have had 385 students that have had to quarantine. That's different than the information I had shared earlier this week with our staff members, because we've had additional students quarantine. This week alone, we've had to quarantine 125 students. And out of those students that I'm talking about, 81% of those are middle school or high school students. And that is actually 5% of our total student population who have returned to in-person instruction. Another piece of data that I think is very valuable for you to understand is the number of staff this has impacted. Since the start of in-person instruction again, we've had to quarantine for at least a day 48 of our staff members. And this week so far, we've had 15 staff members that have had to quarantine. Some of those have already returned, but we've had 15 staff members at one point throughout this week that weren't available because of the quarantine requirement, or they've tested positive. The second part of this question is why does the elementary look different than the middle and high school? I think the one piece of data I shared with you is probably the one that's most valuable to you, and that's that 81% of our secondary students represent the number of individuals that have had to quarantine. Elementary is also structured much different than our middle and high schools. They have the ability to keep their students in a smaller cohort, or they are able to keep their classes contained as classes. At our middle and high school, because of the structure of that classroom, the design of those classes, and the number of electives and courses that we offer, those students aren't able to stay with the same group of students throughout the day without significantly reducing the number of opportunities that those students have had, the number of opportunities that the students have. Also, something that I think parents can truly appreciate is there are challenges with our elementary students when it comes to childcare. At the middle and high school, in most cases, those students are able to watch themselves or take care of themselves while their parents aren't around. And then another factor that is also really important at the elementary level is we found that it's much more challenging, particularly at the younger age, for our students to work virtually. They're just not as equipped or as skilled with the technology, so it creates challenges for them to learn from home. Also know from the elementary perspective, it just looks different in the classrooms than what it did or what it does this week in our middle and high school rooms. And that's because we have a smaller number of students and a larger space on average in our elementary classes. There are definitely cases where our students aren't able to separate at the recommended distance of 6 feet or more, but in most cases, we're able to spread our students out more easily than we can at the middle and high school. We also added this year to support our elementary schools 13 additional teachers, and what that's given us the ability to do is to truly reduce the class sizes overall. If you were to look at an average class at the elementary level in Jessamine County last year compared to this year, it's significantly smaller. I can tell you, though, even though I say that, there are always exceptions to where there may be one class that is larger than other classes, just due to the numbers that we're dealing with. Okay, the next question I think is going to the health department.
All right, thank you, Matt. And I am Randy Gooch, the Executive Director for the Jessamine County Health Department. And we certainly appreciate the opportunity to collaborate with you, and as we partner with the schools on a daily basis, we think that it's important to be accessible to answer some of the questions that certainly our parents and our community have in regards to the COVID response. And we certainly know that everyone's feeling a lot of frustration, throughout this pandemic, because it's changed our lives a lot. And we do want you to know that, we work diligently every day to protect the health and safety of our community, and that's our number one concern, and we work diligently to do that on your behalf. I'll go through a few of these questions here, and then I'll have Dr. Davis actually respond to some of these other questions. One of the initial questions that we received was, what criteria are used to determine if someone who has been exposed to a positive case of COVID needs to be quarantined? I want to first address this question kind of by defining isolation and quarantine, because you hear those two words often, and they are different. Isolation refers to an individual who has had a laboratory confirmed case of COVID-19. And the criteria for that isolation is relative to being isolated for 10 days from the actual date of onset. That's the date that they first experienced symptoms. If they are asymptomatic and did not experience symptoms, then they would be isolated from the date of test, okay, the date that they actually tested for COVID 19. What that isolation consists of is remaining at home in their current residence and not going out to any other locations, public places, any other homes. That means remaining at home. That doesn't mean that they can't go out in their backyard or sit on their front porch, get some fresh air, but they are to remain at home, isolated from other individuals. When we talk about quarantine, quarantine looks a little bit different in regards to the number of days. Quarantine has to occur for 14 days from the actual date of last contact with the individual. So the reason for those 14 days is relative to the fact that the actual incubation period for COVID-19 can occur between day 2 and day 14. So that's why we have to make sure that these individuals are monitored all the way through 14 days to ensure that they stay well and that they don't contract the disease itself. But in regards to who we determine needs to be quarantined, it is defined as a direct contact of a positive case. A direct contact, the standard definition by the CDC and by the Department for Public Health, indicates that anyone who is within 6 feet of a positive COVID-19 case for more than 15 minutes, and that 15 minutes is defined as being cumulative, okay? Doesn't have to be 15 consecutive minutes. That 15 minutes can be cumulative. And the way that the Department for Public Health recommends it is even if the individual is masked, because masks are not determined scientifically to be 100% effective, even though they reduce and minimize the risk for COVID transmission greatly, they still see that and qualify that as direct contact. So those individuals would be quarantined. Now, the way that we look at the school situation, and I think it refers to how Matt defined the structures of the different schools themselves, is we have to look at whether or not these students are seated closer than 6 feet to another student who is determined to be a positive case, okay? When we are doing our contact tracing, if that student who is positive has other children sitting around them closer than 6 feet, and it's more than 15 minutes, they will automatically be quarantined because that is the standard definition, and that is determined based upon their seating arrangements and seating structure, and pretty much no questions asked in regards to that. If it is a teacher that becomes positive, we have to look at the structure of instruction. If that teacher is being able to instruct staying at the front of the room and, does not come in within that 6 feet contact, it's very likely that none of the students would be quarantined within that situation. So there's a lot of different determining factors that we have to look at in determining who would be quarantined in those types of situations. And we've had a lot of different cases with athletic teams and things of that nature. We have to do a thorough investigation to determine how much risk that there is involved related to the actual contact that could have taken place. And I say the contact that could have taken place because we can't rule it out. Okay, it's difficult to rule it out. If you've got football players that are playing and you have a positive case that played on a defensive line and they were playing against an offense, everybody gets tangled up. And as my doctor will tell you, spit equals COVID. And that is true. And it can be transmitted quite highly at that point in time. So many times we have full teams that are quarantined, and you've seen a lot of that across the state of Kentucky. I will move on to the next question that will help cover some of this as well. It says, if someone tests positive in another county, how is that handled? Do you have to rely on the person to self-report to the JCHD or to their school? I'm concerned that people might not accurately self-report and will expose others. The way that we get the information reported to us generally is multiple ways, okay? Ideally, we get a lab-confirmed diagnostic reported case to us from the lab or the provider of record that comes directly to us that lets us know who is that positive case. What we have found lately, though, is many times the school will know before we do, because parents have a responsibility to contact the school to let them know that someone in their family is positive. And the school contacts us, and sometimes we've not had that case reported to us, but we can backtrack and track down with the provider and get that laboratory confirmed documentation that we need to determine isolation and do our contact tracing for quarantine orders. Now, if that person tests in another county, it's still going to come to their county of residence. Okay, whether you traveled to Versailles and were tested, whether you traveled to Lexington and were tested, they still have a legal responsibility to report those results to the health department within the actual location of residence of that individual. So we will get that information, but like I said, it's important for you to contact the schools and let them know, because they can sometimes get that information to us before the provider does. And what that does for us is it gives us the opportunity to more quickly do the disease investigation, do the contact tracing, so we can make sure that we get individuals isolated and quarantined as necessary, because time is of the essence, mostly in response to this. One other question that I will take before I turn it back to either Dr. Davis or Matt, who wants to take the next questions, is related to the schedule that Matt talked about going to Monday. It says, after the AB schedule is implemented, since teachers will all be at school together the whole week, if an A-day teacher or student is exposed to a positive B-day teacher or student, or vice versa, is there a possibility that both A and B-day students will be quarantined? Now, one reason that we're going to this structure beginning Monday is, as Matt said, it gives the school the opportunity to distance these students apart 6 feet. And quite frankly, what we've seen so far to date is generally when we have a positive middle school or a high school student, we can have anywhere from 30 to 50 students quarantined, which is way, way too many. But we believe that going to this structure is going to separate these students in a way where it really eliminates a lot of those quarantine orders that we have to issue to protect those students that would have come into contact with that direct case. Now, what we're in hopes of is we know that all these teachers are at school each and every day, but teachers should be able to maintain that masking and those social distancing orders that are in place so they don't come into contact with each other more than 6 feet. Less than 6 feet for more than 15 minutes. So we would hope that that wouldn't be a situation and that would not happen. Now, let's say that we do have teacher A who becomes positive and they did have a direct contact with teacher B, okay? Even though that teacher B would be a primary contact and would be required to be quarantined, that makes teacher B's students secondary contacts. There's very minimal risk at that point in time, so we would not look at quarantining teacher B's students in that situation. It would only be teacher B that would be quarantined because of the direct contact with teacher A. And I know that that's a little confusing, but I certainly hope that that makes sense. Another situation where we really would only have student A and student B in contact together, it's going to be related to school sports, school activities, and things of that nature where, student A and B may be positive cases and direct contacts in those situations. At that point in time, we have to do a thorough disease investigation and understand what activities that they were participating in, when they participated in them, where were they at within the classrooms, and whether or not that those students are related to that contact. It can get very complicated at times, but I want you to know that we do the very best that we can to ensure that we're protecting every student. But at the same point in time, if we can rule out risk, we do not want to quarantine these students. We do not want to quarantine these teachers, because we feel like as well, as the community does, we need these students in school. We need these students being educated, and that is one of our main priorities. But our top priority is health and safety first. And I'll go ahead. Matt, did you want to take a few more questions and then let Dr. Davis? Okay.
That sounds good. This next question, I'll also ask if Dr. Davis or Randy, if you want to add anything to it, please do. This question is asking if there's a way to determine whether the schools are the source of community spread of COVID. So I guess wanting to make the determination if a student or a staff member is potentially contracted COVID from another student or staff member. The thing that I do want to say is that, especially because we've got a lot of individuals that are asymptomatic, it's hard to say for certain when we do the contact tracing exactly who transmitted the virus to an individual who's tested positive or where it's originated. But I can tell you from my experiences thus far, and I've asked the same question of superintendents in the surrounding districts, we have really realized that we're seeing a pretty strong pattern that when we have been able to identify where there's a high probability that the case has been transmitted from, those cases have been outside of our school system, and they are more commonly transmitted amongst friends out in the community and amongst the families. So, for instance, we've had multiple students that have tested positive, and through the contact tracing process, they've determined that that's originated from the father, the mother, or a sibling. So it's not a perfect science, but in most of these cases, when we've identified, in all of the cases where we've identified the transmission, where we think the transmission has come from, it's been external to Jessamine County Schools at this point. Would you like to add anything, Dr. Davis?
Well, yes, Matt. First of all, I'd like to say thank you and echo what Randy said and yourself. I want to welcome the community to this Zoom meeting. I certainly can understand why there's so many questions that need to be answered, and quite frankly, can understand why the community all across the nation feels like there's a lot of questions still unanswered. I can share with you in my 40 plus years of taking care of patients, I have, and my colleagues I think will echo this, have never seen a infectious agent that has the characteristics of COVID-19, both in how it acts and also in how it doesn't act. But with that as a little introduction, Matt, you're exactly right. And what you said about the contact case, if you will, the literature supports that as well, is that it's generally with family, it's with friends, it's with within large gatherings, but primarily within the closeness of families and close friends is where we're finding that through our contact tracing.
Thank you. And I'm going to just make one more comment with this. I do hope that the community sees in responding this way that and appreciates the fact that our safety measures are working in the schools. The wearing of the mask, the temperature checks, the efforts that we're making to keep people as socially distanced, the hallway procedures, the lunchroom procedures, the cleaning procedures, all of the protocol that we've put in place. While there may be students from time to time that don't follow those, staff from time to time that may not follow those, the majority of the time these things are being implemented, and I hope that you feel like that is true evidence because we aren't transmitting and seeing that transmission occurring in our school district internally, that these measures are valuable and need to continue. Dr. Davis, would you like to take the next question?
Sure, I'll be glad to. And again, Matt, thank you. I have the opportunity to work with a number of counties, and you and your central office team, both day and night, have just been so spot on in keeping in contact with Randy, myself, so that we can do the best to make the right decision. Let's take a look at this question, which really gets into explaining about the virus and incubation time. The specific question says, if you are exposed to a person who tested positive for COVID, but then you test negative, are you still required to quarantine? Well, the direct answer to that would be yes. If you have a direct exposure, as was outlined by Randy earlier, and you're determined to be a primary contact of someone who's infected with COVID-19, then the 14-day quarantine becomes essential. The reason for that is we know that even though you may test negative the next day after your exposure, the third day, the fourth day, etc., we know that this virus can take up to 14 days before it actually manifests in your own body with symptoms. So that's what we determine as all illnesses, viral illnesses have what we refer to as an incubation period. That's the time from when you are exposed to the virus until you became symptomatic or become infected. In the case with COVID, if you have no symptoms, we see in general, as a general rule, think of a mountain. You go up the mountain, you come down the mountain. The peak is generally around day 5 or 6 or 7. That's the top of the mountain, meaning that if you've been exposed in general, you're gonna show symptoms. You're not going to be one of the asymptomatic people, i.e. people without symptoms. But if you're going to show symptoms in general, you will see that occurring around days 5, 6, or 7. However, we have seen people who on day 13 and even day 14 have suddenly developed their symptoms. So that's why when you have this, if you take a number of tests throughout the period after your contact, even though you're showing up negative, you still are required to have and need to have a 14-day quarantine period, because you never know when that virus may in fact show itself in your own body.
Thank you, Dr. Davis. The next question I'm going to ask Randy if he could chime in on this one a little bit with me. And this question has to do with the red status of our district. And it is, will we follow the state guidelines to close if we're in a red level on Thursday? I want to say a couple things about the red status and ask Randy if he could chime in a little. And then I want to talk more so about all the data that we're utilizing. First, the first thing I want to say about the red status, this is only a recommendation that is coming from the governor's office, and it was actually a recommendation or a metric that was developed at the request of the superintendents across the district. And what we were asking for is a starting place or something to alert us as a school system that we need to go deeper into the data and determine if actions need to be taken. It's not a mandate or a requirement that when we hit one of those a particular status that we have to operate a certain way. Again, it's a tool that was created for superintendents to help guide us in that decision making. Also know that this is a process that averages data over a 7-day period, but it does have some inconsistencies, or there's some challenges with real-time data in that process. And if you could, Randy, could you talk about our particular data and then maybe explain why there are at times some inconsistencies in the data on in the state data compared to the Jessamine County Health Department's data?
Sure, thanks, Matt. I can address some of those things. Just to let individuals know, when they're defining like the yellow, orange, and red zones, what they are utilizing in order to make that determination is the incidence case rate per day. And when you're talking about the red zone, you're talking about an average of 25 cases per 100,000 population per day. Now, for Jessamine County, that would mean that we were having about 13 cases on average per day. Okay. Now, just to kind of give you an idea, when you're talking about the yellow zone, that's between 1 and 10 cases. The orange zone, which is accelerated, is between 10 and 25. Now, through September, we had pretty much been teetering between the yellow or the community spread and the accelerated, and we were pretty much staying around the 9 and 10 case rate per day status, which would have been about 4 or 5 cases per day that we were getting. Well, in the matter of the month of October, we have moved much, much higher. And what I want to talk about relative to that is the fact that now we're in the red zone. Most of that, or much of that, has been contributed to our outbreak at Thompson Hood. As most of you all know, we've had about 115 cases in both residents and employees at Thompson Hood. Now, when we look at community spread, I generally like to factor the residents of Thompson Hood out of that community spread calculation. And when I do factor the Thompson Hood residents out of the community spread calculation, that puts us down to about 22 or 23 case rate per day, okay? Or 11 cases or so per day that we are averaging. That puts us into the accelerated zone, okay? It doesn't put us into the red zone. And those are things that we need to give consideration to when we're looking at what happens within our communities and whether we need to pull back on things such as school. And, it gives Matt some good information, I think, in determining how we need to move forward with school relative to that. We do include the employees from Thompson Hood because we know that they're going back into the community, right? There is community spread that can occur from those employees. One thing that I want to say as well to this is we get a lot of questions related to, why such stringent measures at school if, a lot of states or a lot of countries have shown that there's not that much transmission throughout the schools. We have to remember that it only takes one case to get into these congregate care settings, okay? And that's why we have to be very, very diligent in every situation that we do, and obviously try to get 100% compliance with the measures that have been directed to us. And there's only a few tools that we have to fight this disease: the masking, the social distancing, the hand washing, isolating, and quarantine. That's basically our only measures. We don't have good therapeutics for this disease. We do not have a vaccine for this disease yet. So to ensure that we limit community spread, that's the only tools that we have. And that's why we try to structure schools in a way where it limits the risk of transmission. Because it only takes one kid going home to one parent, who that parent works in a congregate care setting, to take it into that setting. And we see that what's happened, okay? In the course of a little over a week and a half, we've had 5 members of that congregate care setting die prematurely, and certainly our condolences and our prayers go out to those families, as well as 2 others who have experienced death in our community in the last week and a half or so. But that's what can happen with just one individual spreading this disease, and that's why we have to take such stringent measures. But we also want to factor what the actual community spread is. And I think in looking at the fact that we're at 22 or 23, I think we have to have a heightened level of response. We need to remind everybody, and this needs to be a sobering reminder to everybody, that we all play a part. We all play a role. We need every parent in our community setting a good example for their children, so their children will understand why they're having to mask, why they're having to social distance, making sure that when they're on the bus that they realize that they have to mask, okay, to ride that bus. We all have that responsibility, and if we all live up to that responsibility, we can reduce the death rate that we have in Jessamine County, which has been relatively good so far. We've been blessed to this point in time. The state of Kentucky has been blessed because, the response that we've had has limited us to about a 1.5% mortality rate of positive cases in our community, in our state, compared to our nation and the world at about 2.6 or 2.7. So we're almost half the mortality rate that our nation and the world is within this response. So, we just need to make sure everybody remains diligent and understand that so as community spread goes, so as the actual mortality goes within our communities.
Thank you, Randy. And I'll just add to that in saying that so while that one piece of data, that metric is very helpful to me to help give me some guidance, know also that I'm working talking weekly with individuals from the health department and looking at the data that they're gathering, which is the number of cases. They share that out on Mondays, have that report for the previous week, the positivity rate, as well as the trend. I think what has been very helpful to me is looking at week to week. You can look at the past 3 weeks and see that we have seen that increase over the past 3 weeks. But then in talking to Randy at the health department and Dr. Davis, they also helped me appreciate and understand exactly what that data is telling them, is that they look at individuals, people that represent those numbers. Also know that I look at a lot of data internally. I share Jessamine County school data. You get some of that information on our district website, and you get some of that information on the state website. But what I'm looking at are the number of individuals, students and staff, who have had to not come to school, be quarantined for any reason. If a teacher contacts me or a student contacts us and says that they have symptoms or they have been in contact with somebody that may have tested positive and they need to stay home, we're tracking that information. Obviously connecting them and encouraging them to connect with the doctor's office and the health department, but we start tracking that information. So we are keeping a database in Jessamine County schools and looking at that by population, teacher and student, and then also by the school, so that we can see what's occurring in the individual buildings. Also are tracking information, the number of individuals who have tested positive, quarantines, and then for our staff in particular, the number of unfilled positions. That's very important to us. And when I'd identified to you earlier that we have 15 staff members out, those are positions that we have to figure out how to cover, and there are situations where we aren't able to cover those positions. So it's a range of data, and then I'm very in tune to what's happening around Jessamine County, because if something's happening in Fayette County, there is a high probability that we will see similar patterns in Jessamine County. And then what's been very helpful to me is the communications I'm receiving from all of our stakeholders, everybody that has an interest in strengthening what is occurring in the school systems, the communications you're sharing with me, the observations, the recommendations, all that's very valuable. And I'm meeting weekly with the superintendents in the surrounding districts. There are several of us that get together and talk specifically about our data and what we're doing to try to resolve some of these challenges. So I would close in that comment by saying that know that we look at COVID and how we are handling this situation the same way we would if it were a snow day. I'm not going to tell the community if there's 1 inch of snow on the ground that we're canceling school every time. We're going to look at all of the circumstances surrounding the inclement weather and see what impact it has on our school operations. And if that 1 inch of snow is going to come in the middle of the day and it's going to warm up, and we're going to be able to travel safely, then it's likely we'll be attending school on that day. So please, when you think of this, understand that it's not just that single piece of data. Us being in a red status right now doesn't tell the true story. And what is most concerning to me in our data is the number of students and staff that have had to quarantine. Okay, the next question is, now that we're moving to the AB schedule at the secondary level, what does this mean for middle schoolers? Will there actually be more social distancing, and therefore can they take their mask off when they're seated at the desk? There will be more opportunities because half of those students on average will be in a classroom on a given day, but it doesn't guarantee that they're going to be 6 feet apart all the time. But again, there's going to be more opportunities for them to be separated. To respond to the mask question, we are still going to require, it is an expectation that's been given to us at the state level, and our data is telling us that the mask works. So we will absolutely still continue to utilize our mask, but we will also still look for opportunities for those masks to be removed. We are doing mask breaks. I've seen several of those that seem to work pretty well. Okay, next question. Does somebody from the health department want to take this one?
Randy, you want me to? There's an excellent, as all the questions are, there's an excellent question here that really gets into my message earlier about the very unusualness, if you will, about the COVID virus. And the question specifically is that if a person was only in contact with a positive case for a short amount of time, less than an hour, for instance, and due to contact tracing, this person has to quarantine, but the person being quarantined has no symptoms. Can the quarantine be shortened to less than 14 days? It seems that a quarantine could be for a shorter period of time for those with limited exposure and no symptoms. Well, the first thing, again, to remind folks, the reason for the 14-day quarantine, as we talked about earlier, is that symptoms can occur clearly up to and including the 14th day. But let's go back to the part of the question that talks about having no symptoms. This is one of the strangest things about this virus that we've seen in all of our practice careers. We know through all the data, through all the research in our country and worldwide, that if you have 10 people that are known to have COVID, we were able to grow COVID out from a sputum sample, let's say, in a petri dish in the laboratory. We know as many as 4 of those 10 people, so 40% of the population with COVID who are carrying COVID and have no symptoms whatsoever. They feel perfectly fine. So you certainly can't blame them. They go to the store, they go to the drugstore, the grocery store, the hardware store, they feel fine. Hence the need for masking, hence the need for social distancing, hence the need for the public health measures that Randy mentioned earlier, good strong hand washing, wiping down surfaces, because here we have an infectious agent that, while in the most case, thank the Lord, in 90% of the cases will give us a mild to moderate illness, we certainly know that in still yet a significant percent of cases, as we've all heard and we know about, there could be tragic results from this virus. So someone who is asymptomatic, using that term to mean without symptoms, they can still spread the virus. So if they have come in contact with someone who has COVID, even though they don't have symptoms, the quarantine is necessary because if they were out and about, they could be spreading the virus, and unfortunately, while they fortunately they don't have symptoms, that patient themselves could give it to someone else who could then have a very unfortunate clinical course. So very, very important to realize that as many as 40% of our people who have COVID show no symptoms whatsoever. And isn't that strange for an infectious agent? As I said earlier in my career, it's virtually unheard of. So I hope that provided an answer to our questioner.
Thank you, Dr. Davis. The next question, what happens if the AB model results in the number of cases going down? What happens if it doesn't get that response? And then how quickly will a change be communicated to parents? This is one that is more challenging for me to respond to, and I hope that you can appreciate and understand why it's challenging to say, because we're looking at a range of data. Right now, again, our positive cases aren't the concerning piece. The concerning piece is the number of quarantines. So the plan that we are rolling out on the 26th, I anticipate is going to reduce the number of quarantines significantly. So if we get those results, then we'll continue to look at that data and see what types of adjustments need to be made, or if we need to continue to operate in this model for a period of time. And then in response to the communication, I am going to try to continue to do exactly what I've done thus far. As soon as we make a decision, I'm going to get that information out to our staff as quickly as I can, and then out to our parents. Have you gentlemen finished your questions, or do you have another?
Actually, I think Dr. Davis has another one that his last question and answer kind of leads right into, Dr. Davis. If you want to talk about the similarities and differences between the flu and the COVID.
Sure, thank you. The question specifically, another good question. Please compare and explain the differences or similarities in the mortality rate from the seasonal flu versus COVID-19's mortality rate. Let's first talk about similarities. First of all, in the illness, we know that it's going to be very, very difficult to clinically differentiate the seasonal flu, influenza, the flu virus, if you will, from COVID-19. Testing is what's going to do this. Testing. The more frequent the testing, the better, because the symptoms are extremely similar. One of the unique symptoms of COVID-19 that you don't see in influenza is this unusual, and the research has now figured out why, but this unusual loss of the sense of taste and smell. And that's a symptom that we see in a number of our patients with COVID. What we know in general, and we could go through reams of data and information about mortality rates, but I think the message I would like to send to our listeners about this is the following. We know that in influenza, the yearly flu, if you will, your real worries of mortality are with the very young, extremely young, the infants, and the elderly. People my age, I can enter that group now. The two extremes of age, if you will. We do know that a difference in with COVID is that the mortality rate is generally with the elderly, and we're talking, I'll use 70 years of age plus. I will say this, and a take-home message would go like this. If you end up as one of the, albeit small, but a very significant to you as an individual, if you end up in the hospital and you're sick sick with the flu, or you end up in the hospital and you're sick with COVID, you probably have about 5 times the mortality rate with COVID than is associated with the annual flu. So again, there's lots of data that talks about starting from birth and going through 90 plus years of age, the different rates per age group. But the real take-home message is that you don't want to get real sick with this, because if you get real sick with it and you end up, for instance, in the intensive care unit, and you had a patient in one room with COVID and a patient in the next room with influenza, and all other factors being equal between the two patients, if you just said we'll just say everything's equal with the two, our patient with COVID will probably have about 5 times the risk of mortality than that of the patient with flu. Both illnesses are significant. Please get your flu shot. Please get your flu shot. Both illnesses are significant, but I hope that kind of broke it down into a way to keep out of the various numbers for the various age groups, but just send a reminder of the importance of this illness.
Thank you, sir. Next question. We're hearing that certain students are not wearing masks at certain times, like on the bus. What are you doing to address this? First, know that we have set that expectation that they be worn, and we are modeling that daily. Also know that the approach that we are taking as a district on this is that we are trying to build habits. Students and staff aren't used to wearing the mask as frequently as they're required to at this point, and we are doing those, giving everyone those reminders when they see them. I've told several people openly when we first made that transition at central office to wearing masks. I made sure that everybody knew if they saw someone else not wearing their mask appropriately or wearing a mask, they were to correct them. And there were a couple occasions where I had to have people remind me. I was moving from one location to another and left my office without the mask. So again, we're trying to develop those habits and encouraging and promoting it for all of the right reasons. But if we do have cases where there's just a flat out refusal, we're taking that through our code of conduct or disciplinary process to address that. I have one final question, and I will ask if Randy or Dr. Davis, if you'd like to respond to this one, please do. This is, we're hearing that students are coming to school sick. What can we do to prevent this? I will tell you that we have had those incidents where that's occurred. We've had students that have come to school with temperatures. We've had students, unfortunately, who have come to school that have been directed through the contact tracing process that they needed to quarantine. And then we've had students that have had symptoms that should have resulted in them not coming to school. They may have carried those symptoms for a couple of days. We are doing the temperature checks with our students and our staff every morning. So if we encounter something, a high temperature, we're immediately separating those individuals and addressing that, having the parents come pick them up. We are also looking for symptoms in our students. If we do have students that aren't feeling good, then we are immediately contacting the families and separating them. I think this is an area where it's very important that our community chip in and help support us in this area. If you do have a child who may have been exposed and that hasn't been reported to the health department yet, it's wise to go ahead and be safe and keep them at home, and then take the necessary actions. And if the hospital or the health department says it's okay to bring them on in because of those circumstances, then we would love to have them back as quickly as possible. Also, this is a unique time where we need to take all of these symptoms seriously. So while there may be in years past that you haven't reacted the way that we're recommending now, this is the time to really look more closely at the circumstances. And if you do have a child that is experiencing any of these symptoms, it is just wise to keep them home and consult with a doctor. Is there anything that either of you would like to add?
Matt, this is Dr. Davis. I would like to really echo and thank you for continuing to mention the word symptoms, as well as talking about elevated temperature. The reason is this. Actually, there's been a lot of studies now that have shown us that actually patients people who are showing the symptoms of COVID, we're talking headache, we're talking runny nose, we're talking sore throat, cough, shortness of breath, some diarrhea, muscle aches, extreme fatigue, loss of sense of taste or smell, that being positive for those symptoms, any one or a group of those, actually will direct us more to finding patients who actually are infected with COVID than just temperature checks alone. So the real message I'm trying to send is that if all of us take our temperature and we have a normal temperature, but we still feel a little bad with some of these other symptoms, please don't think that just because our temperatures are normal that we can't have COVID. You can certainly have COVID without a fever, and as a matter of fact, symptom acknowledgement has been shown to be even a better determinant as to whether someone has COVID than actually temperature checks alone. So thank you for continuing to emphasize the importance that if folks have, if they have symptoms, let's just try our best to stay home from school, and if at all possible, stay home from work.
Okay, thank you.
And Matt,
Yes, sir.
I would say too, I think that you made a great point in a roundabout way that we often hear that it takes a village. Well, with our response to COVID, it does take our community. And, so as the community goes, we know so as the schools and, the other aspects of our community goes as well. And we need to remind everyone that they play a role and they're an influence. They're influencing people around them every day in the way that they behave, the way that they react, and the measures that they're taking to ensure that they're not affecting another person. I think when all this is over, if we could all look at ourselves and say, I believe that I did everything that I could in responding to what the recommendations were, that I limited or minimized the risk for infecting someone that could have become a statistic to COVID. I think that that's what we would all want to be able to say. And that's what we want to encourage our community to be able to do when this response to COVID and this pandemic is over. And I appreciate your leadership. I appreciate the partnership that we have with the schools, because I think that, since I've been here at the health department for 8 years, I know that we have had a very, very strong partnership with our schools, and I think that we both play a role in protecting and keeping our community safe relative to that partnership.
Yes, thank you. And Randy, Gooch, and Dr. Davis, appreciate you gentlemen participating in this town hall. I hope that our community's found it very helpful. I think we can also all appreciate that with each of the decisions or instructional models that we're talking about, there's not a perfect solution, and that none of these options are going to ever satisfy all of us. It's just too complex, and we all have different experiences and are looking at this from completely different scopes at times based on what we are encountering as individuals. But again, I want you to know that we are taking safety as the top priority, and no matter what model that we are operating in, we're going to do our very best to provide the best services for our students. And I have to give a shout out to our staff. It doesn't matter what model we're operating in, and it doesn't matter what position, whether it's a teacher, a custodian, a principal, a school psychologist, a food service worker. Everyone has additional tasks related to keeping your children safe. They have additional steps involved in everything they're doing to accomplish what we're trying to accomplish. So we are working harder, looking for ways to work smarter than I think we ever have. And I know that many of you have had opportunities to see the food service workers in person doing their thing. Many of you have had opportunities to see teachers and our paraprofessionals working virtually with the students and see the passion that we have for the profession and what we're trying to do to support the students in Jessamine County. So again, I appreciate you being honest and open with me, communicating your concerns and sharing recommendations. Recommendations are always valuable as we move forward. I am going to do a quick plug. I talked to you about challenges with filling positions. Jessamine County Schools is short 12 drivers at this point, bus drivers. We pay $16 an hour starting salary, and we are in need of 12 drivers to complete all of our route requirements. So if there is interest, please reach out to Jessamine County Schools. You can call our central office or look online, and there's an application that you could complete. But we are looking for drivers, and then also looking for substitute teachers and instructional assistants. If that's something you may be interested in, please consider. You don't have to do it 5 days a week. It may be that you're only available on Tuesdays and Thursdays, or only available in the morning. Whatever the case may be, we could use all of the support that you're able to provide us. So on behalf of the Health Department and Jessamine County Schools, we appreciate everything you guys are doing, and thank you for tuning in on this town hall. Have a great evening.
Thank you.
Thank you.